Can I correct my facial asymmetry with non-surgical procedures? I have really noticeable facial asymmetry, and I've had it since childhood, but it's only been bothering me for the last 2 years. The right side of my face is what's been affected. What would I have to have done to have the right side of my face looking normal?
Thank you for your question. You submitted your question with a photo, and you're asking, can you correct cheek asymmetry or facial asymmetry non-surgically? And you described further in the details of your question a situation where you were well aware of asymmetry in your face since childhood, and that in the past 2 years it has become more noticeable to you, and you want to know if there's anything you can do. Well, I can certainly share with you how I discuss very similar types of concerns with patients who come to my practice every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people improve their facial appearance from both genetic causes as well as age-related causes has been a significant part of my practice and has continued to evolve as technologies and techniques have improved. So I think you certainly have recognized what is really something, a situation that applies to pretty much everyone. And I always explain to my patients that our facial appearance is actually guided mostly by our bone structure. And the bone structure is like the foundation of everything else. So when you look at yourself and you notice one side looking a little bit different than the other, it begins from that level. And so very typically we would have a discussion about just natural asymmetry and then discuss ways to improve symmetry. So to begin with, when it comes to cheek asymmetry, a common strategy that I apply is to do something called structural volumizing. And the logic is basically this. When you look at ways to enhance facial appearance, when it comes to volume correction, you can place what is generally used, something called fillers that are mostly in the hyaluronic acid family. This is, for example, fillers such as Restylane or Juvederm and all of the different members of the respective filler families. You are either placing it at the skin level, below the skin, or in our case, we're actually placing it at the bone structure level. And this is actually a specific methodology that is not commonly practiced. The reason I do that is that I feel that when you address volume at the foundation, you get a much more natural appearance. And so whether it's for someone who is young, who has a concern about asymmetry that there is naturally part of their anatomy, or with someone older who is losing volume from bone loss and soft tissue loss, structural volumizing has become an invaluable tool in my approach to helping patients with these concerns. So to answer your question, is there a way to make a correction non-surgically? The answer is yes. However, it is important to recognize that there is a certain amount of maintenance needed when you start using fillers. And it's not because you are, quote, dependent on the fillers. People often express concerns to me about becoming dependent, or if they would look, quote, worse after not using fillers. And I explained that there's a big distinction. When you are making up for a relative deficit, whether it's from genetics or aging, well, then you're not really stretching anything. You're actually placing volume in a space that gives you a certain amount of permission to add volume before going to that point where things get very stretched. And for my aesthetic, being stretched is never an aesthetic goal. And so I always remind our patients is that we're doing something that I would refer to more as a correction, which means a conservative placement of a certain amount of volume to achieve a certain desired outcome. Now, when you do place volume at the bone level, you do tend to use more volume than you would when you place the material superficially. So this is something that I think as you're doing your research, you should be comfortable with the doctor you decide to go with. I think it is very important to meet with a doctor who can discuss this in detail for you, with you, and go over this strategic understanding. I routinely see my patients after 2 weeks to look at the level of improvement, and it's essentially a getting to know the individual patient process that's intrinsic to my developing a sense of feel as to what that patient needs as the material eventually diminishes. Now, when it comes to structural volumizing, one of the nice things about this method is that you actually have the benefit of the fillers actually lasting longer. Generally speaking, you can achieve a result that can last over a year. And as the material breaks down, you don't necessarily go all the way back to where you started, but I would say that there is an opportunity to do some maintenance, again, depending on the rate in which the material breaks down. So meet with experienced physicians who perform this type of procedure and learn about your options and come to an idea of what is a desirable outcome that you would find satisfactory, and try this out. What's really nice about using a filler like a hyaluronic acid filler is that when you use something like this, it is of course very safe and it is very easy to work with. It is also reversible. So if someone doesn't like an outcome, they can always have this material dissolved, and that's a huge advantage. Very rarely is that necessary, but it is nice to have that option in case you would need it. So I hope that was helpful. I wish you the best of luck. Thank you for your question.